when did you come to this realization when you found that plants may not be that good for you, and that reducing them and actually going towards a meat-based diet has actually provided benefit to people's health?
I'll start by saying that my previous life was one where I had a more of a vegetarian vegan perspective. So about 10 years ago, I've been, low carb, keto, on the verge of carnivore for basically, 10 years. But before that, I was plant-based. When I wrote Fix Your Diet, Fix Your Diabetes, that book was it was going to be a plant-based book because that's what I was doing. Mm-hmm. But the research didn't justify it. I just started looking at the research, rather it's the Shy study, which compared, I think, Ornish kind of diets, the plant-based to Mediterranean and low carb, and the Mediterranean low carb did the best, and the low carb did the best of all. So I started looking at these studies. I'm like, why is the Atkins diet doing better than the low fat diet? It didn't make sense to my logic. So I had to honor the research, and I shifted. So part of this understanding that plants are not necessarily the most ideal nutrient or source of food was from my research, from my book, and trying to help my patients. When I started my nutrition and functional medicine training, which, interesting enough, a lot of the folk who teach us are more plant-based in this training, which I think is one of the things with nutritional science that's kind of still harming us, is that the next generation of nutrition professionals are still being taught this same way of thinking, that plants are best. But so I learned things in that setting. And when we had you on my podcast, the Protecting Your Nest podcast, we talked about the fact that, plants have, you said that plants are trying to kill you, right? So I asked you that question, and what we talked about were the anti-nutrients, because you have things in your plants that you don't have in the animals. The animals, as you know, they can defend themselves. The plants can't. So you have phytates and oxalates and lectins and things like that are in the plants. So I learned in my training, ironically, from folk who are actually promoting plants, they would argue that you need plants, you need to be challenged. So they believe in this hormesis kind of methodology, where if you're challenged a little bit, it makes you stronger. Just like when you lift weights, you got to challenge the muscles. The problem is if an oxalate is in something like spinach or something, it's gonna make the absorption of the calcium less than optimal, right? So you're eating all this spinach, kale, and all of these so-called good things, they have oxalates, and you can't get the calcium out of it. I mean, that doesn't make any sense. And then you have things like tannins, which are in certain types of things like, tea wine and things like that that may inhibit protein absorption. So I learned these principles in my nutrition and functional medicine training. And I learned that if I have these phytates, for example, and they're going to inhibit my mineral absorptions in certain, because they're in grains and nuts and seeds, then what am I doing here? Like, what am I doing? So I'm eating these things for nutrition, yet the plants are saying, I'm not having that. You're not going to get the nutrition you think you should be getting out of it. So it's really a conundrum. And so as I understood that, and then it started to make sense. I said, why is it that when I eat Brussels sprouts, my stomach bothers me? Why do I get gassy? Why do I not feel good? Why when I eat a steak, I feel nothing? I just feel great. And so other than just being full from it, I just had to listen to my body combined with listening to the science. And when I started listening to the science, I was like, okay, this is making sense. And so I had to honor the science and honor my body. And that's when I started to say, I need to eat more animals and less of these plants. And now I'm at a point where, like last night, I just had a ribeye. I had nothing else. We're still in a home where we still have vegetables that are being served, maybe one vegetable. But most days I'm kind of pushing towards just the animal, because that's when I feel my best. I've never had a day when I've eaten a steak or or chicken or fish in isolation and felt suboptimal ever. I can give you tons of examples when I've eaten plants and felt that way. Even when it's a whole foods diet, that's the crazy thing. So I listened to my body, I listened to the research, and that's how I ended up where I'm at now.
Oh, that's great. Yeah. Well, and that's really good too, that you were open-minded enough after, a decade of being plant-based to, to be doing your own research, writing this book and going like, oh, what the hell is this? Because I mean, that's it, is like these things have defense chemicals, and the idea of hormesis, I've thought was a bit strange. I mean, it could be true, but at what dose? What evidence do
Right.
we have? And we're not talking about one chemical being hormetic. Maybe that one chemical has a hormetic effect on our body at that exact dose that you get one leaf, and that's your hormetic dose. But what about 500 leaves or 50 leaves? And what about all the other things? Because there's 200,000 other chemicals in most of these plants as well. And so maybe one thing is hormetic. Are the others? And are they hormetic at that exact same dose that they come in that leaf? So I think that's,
Right.
that's, maybe, like not, I don't think you're going to be able to make that strong of an argument for the hormesis side of things. And like you say, if this is stopping your body from absorbing nutrients, where's the hormetic advantage there? I think there's, yeah.
It doesn't make sense. Like I said, when you compare it to building muscle, yeah, but when you're lifting weights and building muscle, you're not inhibiting something that's also beneficial. It doesn't make
That's
sense.
true.
So
Yeah.
I go with, with that MBA I have, I'm looking for a return on investment, man. So
Yeah.
I'm looking for, I don't want to waste anything. So I think that that's a better way to do it this. Yeah.
Yeah, I think so. So you have your YouTube channel, and you sort of go by the terminology like a metabolic health doctor. So, what is that exactly? Why is focusing on metabolic health so important to you? Obviously, your book was based on metabolic health. Why is that your focus?
Yeah, well, it goes back to return on investment. I realized that what is making us sick, and so if it starts with diet, we're eating in this, certainly in the United States, I think we always quoted 12% are metabolically healthy, meaning 88% are not. Well, Tufts just came out with the new study, and the new study says, well, only 7% are metabolically healthy. Yes.
Yeah.
So,
All right.
and we should have a link to that study in the show notes. So for anybody watching or listening, just search it, or we'll have it in the show notes. But I'm going to tell you something. That means that 93% of the people you know and love are not metabolically healthy. Well, what does that mean? Well, by definition, we talk about your waist being greater than 40 inches for men, 35 for women. We talk about your blood pressure not being in a normal range. So if it's over 130, over 85, we're talking about your blood sugar being too high. If your fasting sugar is greater than 100, we're talking about your triglycerides being greater than 150. We're talking about your HDL being less than 140, which is the so-called good cholesterol. So what I've learned is, well, if hyperinsulinemia from too much starch and sugar is leading to metabolic syndrome, and metabolic syndrome is the foundation of heart disease and stroke. And as you mentioned in the podcast previously, when we did the Protecting Your Nest, you said, well, they call it diabetes type 3, dementia type 3 diabetes. So if dementia is a metabolic problem, and the Warburg effect, where, and I've heard you talk about that as well. So if we're saying, I'm cancer and I love glucose. Well, how about if we don't give it access to all of this glucose, or at least give it glucose, gluconeogenesis via your pancreas using amino acids and fats. Let's do that as a source where we're minimizing the exposure so our cancer won't have a thriving environment to grow. I think that, so for me, if 70 to 80% of all chronic conditions are related to metabolic syndrome, it would be malpractice for a doctor to not focus on the thing that causes most of the chronic illnesses that we treat every single day. So for me, that's why I decided, you know what, let me focus on this language. My wife, when I first told her I wanted to say, I want to call myself metabolic health doctor, she said, nobody knows what that is. I said, that's the point. Nobody knows what that is.
Yeah.
And my patients may not know, but they will know by the time we finish screaming from the rooftops. They will know what metabolic disease is. They will know about the Society of Metabolic Health Practitioners. They will know that carnivore is a reasonable option to help heal, and keto and low carb. And we're going to say it that way. And think about it. I'll be speaking at the society. I mean, at the metabolic symposium that's sponsored by the Society of Metabolic Health Practitioners, Low Carb USA. And they never called it the Metabolic Health Symposium until this year. Why did they do that? Because they understood that there's many ways to get to metabolic health, and we need to focus on this terminology, because this is actually what people need to learn about and change how they approach their health, by understanding that the only way to treat it is not with metformin, is with lifestyle. There's no drug that's going to fix metabolic syndrome other than lifestyle.
Yeah. Yeah. Well, that's the thing, unfortunately now in medicine, we're really focused on disease management as opposed to, disease prevention or curing people. Like what happened to curing diseases? That's just something that we've just sort of given up on. It's like, oh, that's not curable. Just manage it. Ulcerative colitis or Crohn's or diabetes. You have to just take these medicines, but they will never go away. That you have this disease. Okay. Will you always have pneumonia? No, that's a disease. That's a communicable disease, and you can get over that disease. So that's why I think that these sorts of metabolic issues and illnesses that we call diseases, I think, are misnamed because you should be able to cure a disease. And so I think that definitely we need a lot more doctors taking this approach, and hopefully, being a director of a major, medical facility will start to influence other people. I was just going to ask you quickly on that. Has your influence in what you're doing, is that branched out to the doctors and the providers that work for you?
Yeah. I am fortunate to be in a large health system where our motto is we help people live well. We're also a population. We're probably in a top 10 size-wise for population health. So population health, where you are being asked to, here's resources to take care of the population. You need to take care of the population. What that forces you to do is, if you do a really good job, there will be more resources to have programs. So to help people. So the short answer to your question is yes. It still takes time, because this language, metabolic health and things like that, are not mainstream. So we're currently working on a transformational project to transform care in diabetes. There's about 4 parts of that. And I'm helping to lead the part with another colleague from Wisconsin, where we focus on how we interact with patients for diabetes care. And in that model, I will, along with my colleagues, suggest things that focus on lifestyle. Kind of like what Virta Health does. They use a dietary approach. I may be reaching out to them to hear what they're doing, and they've done the research. So we'll take the research. That's why I think Virta Health is so important, because when you're talking to a large health system, they need to know that there's some research that supports this way of thinking. But in the past, I helped lead our healthy living program, which, in fact, I did a grand rounds with the Society of Metabolic Health Practitioners, where I went into more detail. So for those who are not familiar with the society, definitely consider joining, because you have to be a member to get the grand rounds. And I talked so the healthy living program, getting in front of people, talking about lifestyle, helping them, showing them how to cook food, partnering with the Chicago Food Depository to give them some food. And then what do you do with the cauliflower once you get it? That's one thing I help lead. We have a diabetes prevention program, which is something that we have throughout the country. However, our version kind of does carb restriction as opposed to the standard guidelines that people follow. A COPD program using the same methodologies in the diabetes prevention program. where we help people with COPD. What does COPD have to do with your diet, everything, inflammation and things like that. So you're not having the flares, and also teaching people how to use their inhaler and referring them to pulmonary rehab. You'd be shocked how many clinicians never refer their patients to pulmonary rehab. So we make sure that they get those resources, make sure they do their spirometry so we know how their lungs are functioning. And then we have a food pharmacy. We spell it with an F instead of a P, where we actually have people come to the hospital. But before they get the food, in partnership with Chicago Food Depository, they have to hear us show them, here's how you prepare this food. They won't see potatoes and rice in their packet. They will see non-starchy vegetables and things like that. And if they have canned items, there'll be non-starchy things as well. So those are the types of things that we're doing. We have a new weight management program that has been pushed out to our teams, but then we're going to push it out to our patients, where we are allowing people to have choice. So if they want to do low carb, carnivore, or low fat, that's up to them. But we coach them, because one of the number one success principle, in my opinion, other than the knowledge, they need support, because it's hard to change what you've been doing for years. So it's about giving people the tools to be successful, connecting them with information that makes sense, and then moving your entire health system towards that model. So, because no matter how much we yell and scream on podcasts, YouTube, if we're going to make a real impact, we have to get the insurers and the health systems to learn these approaches. And if we do that, we have the opportunity to transform how we deliver care in the United States and beyond. And because the United States is such a hub of what other countries do, if we get this right, it will it'll affect the entire world. And I might as well say infect. We want to infect them with the knowledge that metabolic health is the way to go.
Yeah. Well, yeah, you're definitely right. I mean, we do have a lot of influence in that regard. I mean, even when the U.S. stopped, said that, cholesterol causes heart disease, stop eating fat, the rest of the countries around the world did take notice and start adopting those guidelines. So hopefully that will absolutely, I hope that is the case, that we can, first of all, change our society and our approach to nutrition and medicine, and then the rest of the world will take that on as well.